This morning on rounds, the team determined that their patient needs a diagnostic medical procedure.
So based on our findings, we have to rule out spontaneous bacterial peritonitis. In order to do so, we're going to do a paracentesis.
After obtaining the informed consent, the physician will make sure he has the correct patient, the correct procedure, and the correct site inside, and use that information for the timeout.
I know we've known each other since your admission to the hospital, but I want to ask you some questions to make sure the procedure is as safe as possible for you.
Okay.
Okay? So what is your full name?
Lily Reyes,
Okay. And your date of birth?
May 5th, 1980.
Okay. And what procedure are we going to be doing today?
Paracentesis on the right side of my stomach.
Okay, great.
At this point, Dr. Clifford Sturmer marks the site of the paracentesis with his initial CS in an indelible marking pen. And then, as seen here, his assistant will interview Mrs. Reyes and collect information to confirm that he has the correct patient identity, the correct procedure, and the correct site inside in preparation for the timeout. Here's the script you're expected to adhere to when performing your timeout.
What is the patient's name, date of birth, or medical record number? What is the procedure and the site and side of the procedure? Describe the mark on or near the procedure site. What position should the patient be placed in for this procedure? What necessary equipment do we have on hand for the procedure?
If there is any disagreement, the process is to be halted and the discrepancy resolved before the procedure begins.
Okay, let's do the timeout. Ms. Reyes, we will include you on some of the questions. The patient is Ms. Reyes. Her date of birth is May 5th, 1980. Ms. Reyes, can you give me your full name and date of birth, please?
My name is Lily Reyes, May 5th, 1980.
Okay. Dr. Wenkebed?
We have Miss Lily Reyes, and her date of birth is May 5th, 1980.
Today's procedure is an abdominal paracentesis of the right lower quadrants. Can you tell me the name of the procedure and where it will be
Each
taking
step
place?
requires patient interaction as shown. At this point, the timeout checklist is read from the script. Step 2, confirming the procedure. Step 3, site marking. Step 4, position. Finally, make sure you check Step 5 for necessary equipment, as it's often missed, and that the other physician repeat back the information verbatim to you. Congratulations, you have completed a successful timeout.